Stand in front of your bathroom mirror tomorrow morning, in good natural light, and look closely at the whites of your eyes. Look at the color of your palms. Look at the small spots on your arms and your chest, because your liver, the largest organ inside your body, almost never cries out in pain when it is in trouble. It has no real way to send you a sharp warning. Instead, it whispers, and it whispers through your skin, your eyes, your hands, and even the color of what leaves your body in the bathroom. By the time most people feel sick, the liver has often been struggling quietly for months or even years. But here is the hopeful part, and the reason I made this video. Many of those early warnings are things you can actually see. If you know what to look for, your own mirror can become one of the most powerful early warning tools you own. I am Dr. Daniel Mercer. For more than 18 years, I have practiced internal medicine, and I have sat with countless patients over 60 who came to me worried about something they noticed on their own body. A yellow tint, a swollen belly, a bruise that appeared from nothing. Again and again, those small visible clues turned out to matter far more than they ever imagined. So today, I am going to walk you through 7 warning signs of a failing liver that you can see in plain and honest language, with no fear and no exaggeration. Stay with me, because one of these signs in particular is missed by almost everyone. Before we begin, if simple and trustworthy health information like this is helpful to you, please take one quiet second to like this video and subscribe to the channel. It genuinely helps me reach more people over 60 who deserve to understand their own bodies. It costs you nothing, and it means a great deal. Now let us look at your liver together. First, let me tell you why your liver matters so much. Because once you understand its job, every one of these warning signs will make perfect sense. Picture your liver as a quiet, hard-working filter and factory, sitting just under your ribs on the right side of your body. Every drop of blood that leaves your stomach and your intestines passes through it first. It cleans out toxins. It processes the food you eat. It makes the proteins that help your blood clot. It stores energy for later. And it handles a yellow-orange waste material called bilirubin, which comes from your old, worn-out red blood cells. Think of bilirubin as the ash left behind after your body recycles those cells. A healthy liver gathers up that ash and sends it out of your body through your stool. Hold on to that picture of bilirubin, because it explains the very first 3 signs we are going to discuss. Let me give you a simple picture to keep in your mind. Imagine your liver as the manager of a very busy post office. All day long, packages arrive from your stomach and your intestines. The manager sorts the good from the bad, keeps the useful nutrients, wraps up the waste, and ships everything to the right place. When that manager is healthy and rested, the mail moves smoothly, and you never notice a thing. But when the manager is overworked and falling behind, packages start to pile up in the wrong corners. Some of that backed up material spills into places it was never meant to be, into your skin, your eyes, your hands. The visible signs we are about to discuss are, quite literally, that backed up mail showing up where you can see it. Now here is the important truth. The liver is remarkably tough and forgiving. It can keep doing its job even when a large part of it is damaged, and it rarely complains. In fact, it is one of the few organs in the body that can regrow some of its own healthy tissue when given the chance. That toughness is a blessing, but it has a hidden cost. Because the liver stays so quiet for so long, the damage can build up without any pain to warn you. That is exactly why the visible signs matter so much. They are often the first real evidence, sometimes the only early evidence, that the quiet factory inside you is falling behind. So let us begin. 1 sign at a time. The first sign, and the most famous one, is a yellow color in your skin and in the whites of your eyes. Doctors call this jaundice. Remember that yellow-orange ash, the bilirubin, that a healthy liver clears away. When the liver is failing, it can no longer keep up. The bilirubin builds up in your blood, and it begins to stain you from the inside, like a yellow dye seeping into a white cloth. The easiest place to spot it early is the white part of your eyes, which may take on a soft yellow tint before your skin does. According to the Mayo Clinic, yellowing of the skin and eyes is one of the classic signs of cirrhosis, which is advanced scarring of the liver. So tomorrow, in good light, look carefully at the whites of your eyes. If they look yellow, that is a clear reason to see your doctor, not to panic, but to get a simple blood test that can check exactly what is happening. The second sign follows naturally from the first, and it is the color of your urine. When that yellow-orange bilirubin has nowhere good to go, your body tries to flush some of it out through your kidneys. And when it does, your urine can turn a deep, dark color, sometimes the shade of strong tea or cola, even when you have been drinking plenty of water. Now, I want to be fair with you. The most common reason for dark urine is simply not drinking enough fluid, and that is easily fixed with a glass of water. But here is the test. If your urine stays dark even after you have had plenty to drink for a full day, and especially if it appears alongside any yellowing of your eyes, that is your liver asking for attention. Make a note of it and bring it to your doctor. The third sign is the other side of that same coin, and most people have never been told to look for it. It is pale, clay-colored, or chalky white stool. Here is why this happens. Remember, a healthy liver sends bilirubin out through your stool, and that bilirubin is actually what gives a normal stool its familiar brown color. So if the liver or the bile ducts are blocked or failing, that coloring agent never arrives. The result is stool that looks pale, gray, or almost white, like wet clay. Most people never think to look, and so they miss it entirely. But pale stool, especially when it shows up together with dark urine and yellow eyes, is a meaningful sign that bilirubin is not flowing where it should. If you notice this, please do not brush it aside. Mention it to your doctor. Let me pause here and tell you about a patient. I will call him Frank. Frank was 71, a retired carpenter, a proud and private man who almost never went to the doctor. His daughter brought him to me, not because he was in pain, but because she had noticed during Sunday lunch that his eyes looked a little yellow under the kitchen light. Frank insisted he felt completely fine, and in a way, he did. But that yellow tint, paired with urine he admitted had been dark for weeks, led us to a simple blood test. We caught a liver problem early, while there was still real room to act and to protect his health. Frank often says his daughter's sharp eyes at the lunch table did more for him than anything else. I tell you his story because it shows the whole point of this video. The signs are visible. You only have to know to look. Now, before we go on, take a breath. If you have noticed one of these signs, it does not mean disaster. It means information. And information, brought to a doctor early, is a gift. Let us continue. The fourth sign appears on your skin, and it is one of the most fascinating. They are called spider veins, or in medical terms, spider angiomas. These are small clusters of tiny blood vessels, often with a little red dot in the center and thin red lines branching out from it, exactly like the legs of a spider. They tend to show up on the upper chest, the shoulders, the neck, and the face. Why does a struggling liver cause these? Part of the liver's job is to balance the hormones in your body. When it falls behind, certain hormone levels can shift, and that shift causes these little blood vessels to dilate and become visible near the surface of your skin. A single spider vein on its own is usually nothing to worry about, but several of them appearing together, particularly across the chest and shoulders, can be a recognized sign of liver strain. It is worth showing your doctor. The fifth sign is in the palms of your hands, and I want you to look at yours right now. Turn your hands over. In some people with liver trouble, the palms take on a blotchy red color, especially around the outer edges and the base of the fingers, while the center stays pale. Doctors call this palmar erythema, which simply means redness of the palms. It comes from the very same hormone shifts that cause the spider veins. Think of it as the same underlying weather, just showing up in a different part of the sky. Now, plenty of perfectly healthy people have naturally pink palms, and warm hands or a warm room can redden them too, so I do not want you to alarm yourself over a normal color. The thing to watch for is change. If your palms have recently turned noticeably red in that blotchy pattern, when they were not that way before, especially alongside any of the other signs we have discussed, it is another clue worth bringing to your doctor's attention. The sixth sign is one that often frightens people, and that is easy bruising and bleeding. Have you noticed bruises appearing on your arms or legs when you cannot remember bumping into anything? Or that a small cut seems to bleed longer than it used to? Here is the reason. Remember that your liver is the factory that makes the proteins your blood needs in order to clot properly. When the liver is failing, it makes fewer of those clotting proteins, so your blood becomes slower to seal itself, and you bruise more easily and bleed a little longer from small nicks. The Mayo Clinic lists easy bruising and bleeding among the signs of advanced liver disease. Now, many things can cause bruising as we age, including thinner skin and certain medications, so this sign alone does not point only to the liver. But unexplained easy bruising that is new for you is always worth a conversation with your doctor. The seventh sign is one you can both see and feel, and it tends to appear later. It is swelling. You may notice your ankles, your feet, and your lower legs becoming puffy, where a gentle press of your finger leaves a dent that slowly fills back in. Or you may notice your belly growing larger and rounder, sometimes surprisingly quickly, even when the rest of you has not gained weight. That belly swelling, when fluid collects inside the abdomen, has a medical name, ascites. Here is why it happens. A struggling liver makes less of a protein called albumin, which normally works like a sponge to hold fluid inside your blood vessels. With less albumin, fluid leaks out into your legs and your belly and simply pools there. Swelling has many causes, including heart and kidney conditions, so it always deserves a proper medical evaluation. But new swelling in the legs or the abdomen, particularly alongside the other signs, is an important one to never ignore. Now let me give you a quick bonus sign, because it surprises so many people. It is itching. A deep, persistent itch all over the body, with no rash and no obvious cause, that can be worse at night and can drive a person to distraction. When the liver cannot clear certain substances properly, they can build up under the skin and quietly irritate the nerve endings, causing that maddening whole-body itch. Patients often describe it as an itch that seems to come from deep under the skin, where scratching never quite reaches it. Of course, dry winter skin and many other ordinary things can make a person itch too. But unexplained, relentless itching, with nothing on the skin to explain it, especially when it lingers for weeks, is worth adding to your list and mentioning to your doctor. Let me gather these together so they are easy to hold in your mind. Yellow eyes and skin, dark urine, pale clay-colored stool, spider veins on the chest, red blotchy palms, easy bruising, and swelling in the legs or belly, plus that bonus, unexplained itching. 7 visible signs and 1 extra that your own body may be trying to show you. Now, I must be very clear and very honest with you about how to use this information, because this matters as much as the signs themselves. Not every yellow tint, dark urine, or red palm means your liver is failing. The human body has many ordinary explanations. Dehydration darkens urine. Naturally pink palms are common. Aging skin bruises easily. So please do not watch this video and convince yourself of the worst. That is not my goal, and it would not serve you. The real power of these signs is this. When you notice one, and especially when you notice 2 or 3 of them together, you have a clear and simple reason to make an appointment and see your doctor. From there, a basic blood test, often called a liver panel, along with a simple physical exam, can tell your doctor an enormous amount. These tests are easy, they are widely available, and they take the guessing out of your hands and place it into expert ones. That is exactly where it belongs. Here is a gentle word on who should pay especially close attention. If you drink alcohol regularly, if you have been told you have fatty liver, if you live with diabetes or carry extra weight around the middle, if you have had hepatitis, or if you take several medications that the liver must process, then these visible signs deserve your extra care. I am not saying any of these things means your liver is failing. Many people in each of these groups have perfectly healthy livers for their whole lives. I am only saying that if you are in one of these groups, your weekly glance in the mirror is even more worth keeping. None of this is meant to frighten you. It is meant to help you watch your own body wisely and to bring anything you notice to your doctor, who knows your full history and can guide you safely. I also want to say a kind word about feelings here, because noticing a change in your own body can stir up a lot of fear, and fear sometimes makes us look away rather than look closer. If that is you, I understand it completely. But please remember that looking away never made a single problem smaller. Looking closely and asking a doctor early is one of the most loving things you can do for yourself and for the people who depend on you. The earlier any liver concern is found, the more options there are, and the gentler those options tend to be. So let courage, not fear, be the thing that walks you into your doctor's office. Now let me leave you with one simple habit that costs nothing and could matter a great deal. Once a week, in the morning, in good natural light, give yourself a 30-second body check. Look at the whites of your eyes, turn over your palms, glance at your chest and arms for new spider veins or bruises, notice your ankles and your belly. That is it. 30 seconds, once a week, the same way you might glance at the dashboard of your car. You are not looking for a reason to worry. You are simply staying familiar with your own normal, so that if something changes, you will be the first to notice. And here is a small bonus habit to stack right on top of it. Be kind to your liver every day by staying well hydrated, going gentle with alcohol, and keeping a steady, healthy weight. Your liver is forgiving, and these everyday kindnesses give it room to keep doing its quiet, vital work. So let me bring it all together. Your liver rarely shouts. It whispers through your skin, your eyes, your hands, and the colors your body produces. The 7 signs you can see are yellow eyes and skin, dark urine, pale stool, spider veins, red palms, easy bruising, and swelling, with itching as a bonus clue. None of them is a diagnosis on its own. Each of them is simply a message, a reason to look closer and to talk with your doctor early, while there is the most room to act and to protect your health for the years ahead. If this was helpful to you, and you would like more plain, honest explanations of what your body is trying to tell you, please subscribe and stay with us here. This channel exists to help you read the signs your body gives, so you can stay strong, aware, and independent well past 60. I am truly grateful you spent this time with me. Take good care of yourself, and I will see you in the next one. And one last important note. This video is for general educational and informational purposes only, and it is not medical advice. It cannot diagnose any condition. Always speak with your own qualified healthcare provider about any sign or symptom you notice before making any changes to your health, your diet, or your medications. Your doctor knows your body and your history, so please bring these observations to them and let them guide you safely.